Excellent. Well, jolly good evening to everybody. This is a first for me, and I feel a lot of imposter syndrome here because I've got somebody who's kindly joined me for a chat, who has far more experience in doing this than I have. So, um, quite apart from this technology being completely alien to me, on top of that, this is also a complete debut for me. So, apologies in advance if things go wrong or the recording doesn't work or whatever it is that goes wrong. But Nickita, a very warm welcome to you. It's lovely to see you. We met, I guess, must be about 3 or 4 years, probably more than that, about 4 years ago, um, down in Bath at a conference that was organised by Tess Laurie, where you spoke, um, and I thought was a very convincing and deep, deeply held views that came across from your speech. And not that that's perhaps a huge surprise, but despite having five children and having been at the birth of all five of them, I have a little bit of experience of what happens, but clearly I'm not going to know many things that many women will know who have had children. So I learned a lot from that. And you and I have been following each other on a health group that we're on together, um, which has been great, very, very interesting for me to learn a lot more about what you've done. So I'm going to just briefly introduce you, although in fact, uh, if people go to Nickita's website, which is whenpushcomestosshove.co.uk, there is the best summary of what Nickita does. But she has been a very prominent figure in women's health and in spiritual development, and is currently pursuing a PhD in lifestyle medicine. She speaks internationally and teaches on physiological childbirth, which is a source of knowledge that is highly sought after by midwives who are looking for traditional births. She believes that the true transformation in childbirth in women's lives goes far beyond superficial education, and that it lies in self-development and in healing core wounds. She has spoken on many occasions, so I'm going to just ask her to add her introduction, and then as she talks about her experience, hopefully I can bring out things if she doesn't mention them and ask questions. So Nickita, over to you.
Thank you so much, Benny. Thank you for that introduction. Yeah, it's been wonderful being on the health chat, certainly to get to know people and where they're at on their health journey. So essentially what I do, I'm a specialist in childbirth and also trauma. So that's childhood trauma, ancestral trauma, and I also, as Bernie said, I'm just doing my PhD in life medicine. So I look at the emotional root cause of illness. There's layers. There's the emotional root cause, and then the terrain of the body and what's happening there. But we can probably get into that a bit later. So I started when push comes to shove in 2021. I've been a natural birth practitioner for 16 years. I started out in midwifery. I didn't care for it at all. I found it was very pathologized and it was kind of like a conveyor belt system and it didn't feel right. To be honest, a lot I know is self-taught. I started asking deeper questions about birth and I started noticing patterns. And then in 2021, I started a Telegram chat called Awakened Pregnancy and Birth. It's still going now. And the lovely Rob Minotti shared it. And overnight, things just went bang. I went on Mark Atwood's show. And then I started teaching people about what I know about birth. And I created a course for natural birth practitioners who perhaps don't want to learn, let's call it medicalized midwifery. So it's solely about physiological birth. It's nothing clinical because birth is not a clinical process unless it has to be, which is very rare. But sadly, what we see now is birth being pathologized. And sadly, most women we see are having intervention thinking they need it when to be honest, most of the time the interventions that they start in the hospital cause the cascade of interventions. And then I start to notice a pattern. I've always been heavily interested in psychology. I did psychology A-level, and I've excuse me, I have a bit of a frog in my throat this evening, so pardon me. I've always been obsessed with human behaviour, probably because I had to be, because my childhood kind of depended on me understanding human behaviour. And I started to see that birth trauma is not primary, it's secondary. And I could see that there are 3 core wounds that humans carry. You can have 1, 2, or 3, and they tend to be, I'm not enough, or I'm too much. I'm going to be rejected, and I'm going to be abandoned. And if those wounds are being stored in the body and they're not, the person isn't aware of them and they're unhealed, it can bleed into birth space. So, for example, if a woman is operating from a rejection wound, and maybe the adult drivers there is she's become a people pleaser, well, she's going to struggle to say no to an unnecessary vaginal exam, especially by someone in authority. And we can see the cascade can play out from there, because it's our emotional root cause driving our behavior, driving our choices. I'm not here to say it's anyone's fault at all. It's just a byproduct of what is unhealed. So I started to make sure that I was training birth practitioners that the first module, they have to do the inner work, because we can't enter a birth space with our shit. We can't bring our ego into it. We have to come in being woman with woman. So midwife is meant to mean with woman, but sadly these days it just means with system. And we serve women, not the system. Anyway, long story short, when push comes to shove, to my knowledge, is now the only decentralized maternity structure in the world. And I've trained over 160 natural birth practitioners in 10 countries. Last year, we had a home birth rate of 77%, 0% instrumental delivery, and 7% C-section rate. And now, if you look at a bog standard birth on the NHS, you're looking at least a 50% C-section rate. I mean, if you Google it, it will say 30, but if you look at, I have a colleague who is very into statistics. Her name's Kemi Johnson on Instagram, and she pulls apart statistics, and I think we can clearly see it's getting up to a 50% C-section rate. And I'm not here to say there shouldn't be any medical intervention, but I am here to say unnecessary medical intervention you should be mindful of, because it does cause problems.
That's an enormous number. I mean, what do you think the prime reason for that is? And I suspect I know where this will take us, but and because money unfortunately plays a bigger role in this than perhaps we'd like to admit. But is it your sense that a couple, and I guess it often is a couple's decision still, at least if they're together enough and open enough, are so frightened of birth that they are just enthralled by this notion that C-section is the safest way of doing it, unaware of what those consequences might be, or what do you think has been the real reason for that huge amount of C-sections that we're seeing?
Yeah, I mean, it's pretty nuanced. There are many layers here. So I think the first reason C-sections have become prevalent is because they have become safer. Not a safer option than a vaginal birth, but the operation itself has become safer. So let's look in the 1940s, 1950s. They would be doing a vertical incision to get the baby out. And that is a huge surgery. But now they have mastered getting the baby out very, very quickly. I'm sure most people can see where a C-section incision is, just above the bikini line, and it's horizontal. And because C-sections have become a bit safer, I think people are seeing it's just an alternative, but it is major surgery. So that's one layer. Two, money. So the Care Commissioners Group pay the NHS nearly £4,000 for every emergency C-section. Now, I know we've got our NHS, but I don't think I really need to convince an audience here that it's not as it seems, so I won't really go into that today. The other thing is fear. And in fact, everything comes from fear if we look at systemic care. So we live in a culture that is so unhealed that we operate from fear. So the maternity guidelines are so stringent and quite frankly quite tyrannical and make little sense. So would you care to guess, Bernie, what percentage of evidence maternity care is based on?
I would be literally guessing, but I mean, given the way you've asked that question, I'm going to say it's less than 20%.
It's 8%, category A, evidence-based. So you'd be hoping that what women are being told is based on some good evidence, right? But unfortunately, that isn't the case. It's the lowest evidence-based practice in medicine.
Wow.
And the maternity system are terrified of being sued. Now, if there is a birth injury and it goes to court, they are asked, did you do XYZ intervention? And as long as they say yes, then that's then covered. But what they're not seeing, because the people who are scrutinizing this practice have a very tenuous grasp on birth, they're not seeing the interventions that they started could cause the problems they're in court for. So as long as they're ticking all their boxes, yes, we did this, we did this, we did this. Now, the maternity system...
If I could just so quickly interrupt, presumably the medical industry also then rallies round those practitioners, and if something goes wrong on that, and protects them, or in order to,
yeah.
Is that too cynical a thought, or?
No, they are protected. In fact, there's a friend of mine who anyone should really follow at the moment. Her name's Victoria Rickson, and she's the whistleblowing midwife. And my God, had some problems from speaking up. She even heard midwives like you go missing. It's revolting, and it's all built on bullying and fear. So they're very fearful that they're going to get sued, but why are they fearful they're going to get sued? Because we sue them. And why do we sue them? Because we trust and we hand over our birth experience and we assume it's taken care of. Now, I don't know how this is going to come across. If you are expecting a baby or plan a baby, educate yourself, because no one's coming to save you. And if you understand birth, you understand the physiological process, you don't need a midwife these days, you need a human rights lawyer. It's insane. But if you understand the physiological process, you understand your rights, how to navigate the system, if indeed you want to use the system at all, because that's another point that I should raise. There's no law that says anyone has to engage maternity care, not one. But women don't realise. Now, even if they do, they'd be like, well, I need help. I need a medical professional, because they assume birth is inherently dangerous. Now, strangely enough, Bernie, I'm not here to say birth's inherently safe, because it's not. Birth is as safe as life. But from my experience, birth will unfold beautifully if women feel safe, loved, wise, They understand their body. They're connected to it. They're not here in their heads all the time. They have mind-heart coherence. Their intuition is speaking louder than the fear. And they understand nutrition. They understand how to prevent common ailments in pregnancy. That's empowerment. And then they won't hand over their birth experience. But 9 times out of 10, well, you don't know what you don't know, do you? So if you have no idea that when they're telling you to come in for a C-section or come in for an induction, most women don't know they can say no. And why would they? They think, well, they're telling me for a reason, right?
So I just want to come back on that inducement bit, because I mean, it seems to me, and again, I'm coming at this from a very lay, novice angle, but it seems it's always surprised me, and as I say, I have had this 5 times, that the first doctor that you see with your pregnant wife tries to establish when the birth date is likely to be, and uses as a calculation the date of the woman's last period, and then adds 9 months to it. So it doesn't, I mean, my understanding is that pregnancies are 10 months, not 9. So then you get to the stage with the first baby, which again, correct me if I'm wrong, these are just my impressions over the years. First babies tend to be later. So you then have a panicked woman, panicked mother-to-be, who thinks that she's already late. And the doctors tend to encourage that feeling. And then you go down the inducement route, which is not a pleasant experience. And you also go down the route of trying to make a birth, make a birth physically easier by using chemicals to get the woman to open up more easily. Can you talk a bit about that and correct me on any errors, but just expand a bit on where we are? I mean, to me, that seems to be the beginning of the start of where the difficulties are. I mean, apart from the fear that happens before, but in the actual process, once a woman's pregnant, she's then given all this information, most of which seems to be not right.
Well, yeah, I mean, this is a very popular topic amongst birth workers, the argument of the due date. So in the early 1800s, some fella called Nagel, who's this German obstetrician, he calculated pregnancy gestation based on the lunar calendar, and we still use it today. Now, women can be pregnant to up to 43 weeks, but we don't really see it because it's not allowed, and most will be induced before that time. When push comes to shove, we keep a diary of what's called the unicorn births, and we say unicorn because they're so rare. So we have 42, 43 weekers, and we just keep our statistics like, well, why are these people having a perfectly normal physiological birth at 43 weeks? How is this possible, according to your data? Okay, so there is some basis of saying that, well, we need to induce. They have some data that suggests if you go over 41 weeks pregnant, the chances of stillbirth double. But there are several problems with that. One, we don't know how far a woman actually is. So if you're basing it on a scan, which they tend to do, they love dating scans. Any scan has got at least a 15% margin of error. So we don't know if those dating scans are accurate. I'd be more inclined to go on a woman's period and say expect to be pregnant for up to 42 weeks. The other issue with the chances of stillbirth double, I don't think many women think to ask the question, double of what? Because if it's 1 in 5 to 2 in 5, that's quite serious. But it isn't. It's goes from 1 in, I think, 793 to 2 in 793. But we also have to look at a deeper level here. So if we're trying to understand physiological birth, how are we observing the women get the data? Well, we're looking at them in hospitals. And hospitals are not conducive to physiological birth. You can't understand the behavior of birds if you observe them in a zoo. So let's look at the data. Now, honestly, you can find data to support anything if you want, and this is where your intuition comes in. Women need to listen to their intuition, because I have never seen a woman's intuition wrong. I've seen them ignore their intuition. This is sacred. This is deep knowing, and we don't need data to know that our babies are okay or not okay.
Yeah, and I guess the reason why, and it's not just true of women in childbirth, it's true of most of us, I guess. The reason why we begin to ignore intuition is fear, is that we're told something else we're told something different from what our intuition says in many academic areas. I mean, certainly in my business life, I have concluded that the times when I've ignored my intuition, I've regretted it, almost always, even in areas that I didn't have much knowledge of. It surprised me enormously with my own children how quickly it was obvious to my wife at the time of what was wrong or what was going wrong, even though she was obviously in a state of discomfort, pain, some trauma, because it was all new. So I mean, clearly that intuition is there, but it's buried for reasons of fear, buried because we've been told by the doctors to ignore that. And I guess when you look at the history of that, whilst childbirth clearly has got safer over the centuries, it's something that we've been doing right since the beginning. So we do have a fair bit of experience, and it seems to be that the route that we've gone from naturopathy to allopathy, or allopathology, however you want to call it, has really influenced how we think and what we believe in.
Yeah, for sure. And I'd like to address that, actually, because it's a very common question. Well, women used to die all the time in childbirth, so thank God we have hospitals. I agree with that. Thank God we do have hospitals. Thank God we have competent, masterful surgeons to help us deliver our babies when we need support. But we've gone too far the other way. And here are the reasons why women used to die, and still do, by the way, die in childbirth. So there are three main reasons birth goes wrong. One is poverty. So if you live poverty,
yeah,
if you live in an overcrowded environment where disease can spread like wildfire, if you are poorly nourished, that's a recipe for an issue during labour. Same problems we have now. And don't forget, when Semmelweis discovered about bacteria, how he dropped the childbed fever rate in his hospital, because he discovered that the women who were dying from childbed fever, they'd all been attended to by surgeons, and surgeons were just touching cadavers without washing their hands, and those were the women that were dying, but the midwife attended women weren't. So he told them to start washing their hands. They thought he was crazy, but it dropped the mortality rate significantly. And the poor guy died from an infection in a mental asylum, I think. But you know what, look, just let's have a fleeting glance at the last 100 years of obstetrics, shall we? One thing that we're doing too much and we don't know enough. So in the 30s, they were giving women x-rays to check the size of their pelvis, and that was giving babies cancer. They stopped doing that. In the 40s, they were using thalidomide.
They stopped doing that in the 50s. Am I right in saying that, or was it the 40s?
The thalidomide?
No, the x-rays.
X-rays, the 30s and 40s. Yeah, they stopped doing that in the 40s. Then there came the thalidomide babies. Took 12 years to get that off the market. Then in the 90s, they were giving women a drug called Cytotec to induce labour from a previous cesarean section, and it ended up with thousands of dead babies and ruptured uteruses. And obviously we have our recent issue, which is, I'm not going to go into that. I think we all know what I'm talking about.
Well,
But
you can. I mean, I think you should.
it's the COVID vaccine. The miscarriage rate has just gone up significantly. And we already knew there was a problem with that because the study they did on ferrets, I think it was in 2012, it affected the syncytin protein, which is the protein responsible for implanting the placenta, and they all miscarried. And I was seeing some very strange placentas riddled with clots, looked like a leopard. Some very strange things. But strangely enough, I'm actually no authority on the subject because most of the women I serve have not been vaccinated. So I don't see it very much.
Just on that, because there'll be a strong body of, I'm going to call it traditional medicine because it isn't, but that's what people think it is. It's modern medicine, who think that it can't have anything to do with the COVID jab. I mean, and I think it's fair for us to be in this conversation to allow the skeptics of that argument to challenge that. Is it possible yet for us to point evidence at the COVID jab? Is it genuinely possible to say that here's the evidence, this is why it is?
Yeah, there's tons, but to be honest, at this point in my life, if they're still not getting it, ignorance is a choice. And I don't have the time or the funds to explain this anymore because, like I said, ignorance is a choice. There is so much out there. There are women like saying, you've harmed me, this has harmed me. But because we're not seeing peer-reviewed studies, and if they are, they're put to bed somewhere, then listening to women. And until people listen to women and they need their poxy data, listen to women because they matter, their voices matter. But who's going to fund the study? Who's going to fund all that? The evidence is the thousands of women I have spoken to over the last few years traumatized. And I'm not just talking about the COVID vaccine here. I'm talking about the harm done in hospitals because women aren't being heard. They don't want this, they don't want that. They feel they have to acquiesce to X, Y, and Z. I honestly think there's no point. And if you're either going to be interested or you're not. And if you want to,
I think that's fair. And I think many of us who've gone through this last period of coming from a good place and wanting to warn people, particularly those of us that are not scientifically qualified, which I'm not, but just saw things that were odd and seemed to be illogical in terms of some of the rules that were passed down, and that raised some of our fears, and we tried to pass that on in good faith to friends and family. And as everybody can attest, friendship groups have changed, have broken up, families have taken polarized different views. But I think it's I understand your frustration and completely share it in terms of some of the reactions you get. But nevertheless, I still think we sort of have a bit of a duty to keep telling people and to keep reminding them, because it's very easy to memory hole what's happened, and humans are very good at forgetting. I mean, the best example is always if you go sailing and you become very seasick and you land on shore. Within half an hour you've forgotten what happened, and you're happy, and you feel secure. And most of that is psychological. And the trauma of what you went through, sitting in the bottom of a boat and being sick and feeling awful for 12 hours, whatever it is gone. And I think we just do that. It's a survival instinct. It's a coping instinct. It's not something we want to remember. Of course, deep down, it still sits there. So I sort of think I don't know. I think we still have some duty, some role to keep on explaining what's going on. But I think people want evidence, and it's hard to get that evidence. Would you say it's? Can you?
Yeah, it's hard to get that sort of evidence. I mean, okay, I would just ask another question. Have we got years of data to say it's safe? And the answer is no, we don't. And I think that's all people need to know.
Yeah, I agree. And I think you can go down this because I don't really want to go too far down the COVID thing, because that's not really what this is about. It's just another reason, another cause. But one listener listening in has written to ask me to let you know that she had her pelvis x-rayed in 1991 when her daughter was a potential breech birth, so long after the 1940s. So I think this practice must have got. She can't be unique in that. So I think this practice may have gone on for a lot longer than perhaps we think.
X-ray, not a scan.
No, X-ray.
Right. Oh, okay. Ultrasound wasn't too prevalent then. Okay. So yeah, I mean, they still do X-rays now. I mean, in the 30s, they were doing X-rays as a bog standard practice on every woman.
And they actually said to her that unless she was willing to have the X-ray, they wouldn't allow her a natural birth and would take her straight into a C-section.
Oh, yeah, they do that now with breech birth. It's insane how breech babies are denied a physiological process because of a tenuous grasp on breech physiological birth from the providers. It's insane. So I can't believe that was done in the 80s. That's just awful.
1991.
That's dreadfully sad. So breech is a variation of normal, and sadly, the birth practitioners who are skilled in breech birth are about as common as rocking horse poo. But there are some unicorns around who still understand it. And if your care provider doesn't understand the difference between an upright physiological breech birth and laying you on your back in stirrups, run a mile. Because babies are denied the human microbiome by going straight to C-section. And yeah, it's not that there's an additional risk. So there was something called the Howard trial, and they decided that breech birth was safer being a C-section. But then that was redacted because they realized that breech babies who were having issues were being attended to by obstetricians rather than midwives. And there were a few other nuances as well. But one thing we do know... Sorry.
Just hold your thought there. Just on the microbiome, I think there'll be people listening who might need that explained a bit more. So I think it would be helpful if you just explain that, get a bit into detail of what the impact of that is.
So when a baby is born, normally they come through the vaginal canal, and that process, it seeds them with the human microbiome, with the good gut bacteria, and it goes into the mouth, they swallow it, and it kind of kickstarts the immune system. Babies already do have an immune system, of course, but it's optimizing their immune system. Then the next step to that is skin-to-skin contact. That will help with the microbiome, and then breastfeeding, of course, is optimal. If a baby is born by a cesarean operation, that process does not happen. And I'm so sorry, I've got a cat in the background doing things he shouldn't be. I hope that's not too distracting.
Oh, great. If
a baby is born by cesarean operation, first of all babies born by C-section have something called wet lung. They don't have a good squeeze through the vaginal canal, so they're more likely to have respiratory problems. C-section babies have far more eczema, asthma. I don't know if you've noticed children now, but there's allergies to everything. That's due to the higher C-section rate. Now, if a little girl was born by C-section, if she grows up and even if she has a vaginal birth, she can't give her baby what she didn't get. So there's so many reasons why we're getting more and more unwell as the years go on, but C-section certainly contribute to that.
Yeah, I was going to say, so that probably C-section will be one cause, and it's given that it's probably the earliest cause, as it were, on that human being, because it's the first thing that happens to him or her. But there are other causes for those allergies too. And I guess, as we go along a bit, we can talk a bit about infancy, and you can talk a bit about that, but there must be other reasons too that cause these allergies.
Yeah, I mean, people who weren't breastfed are much more likely to have allergies. I can't even describe how important breast milk is. There's no alternative. There's no breast milk. There's no other milk that works the same as breast milk. It's liquid gold. When the baby is feeding, the nipple detects how hot or cold milk should be. If they've got a fever, it will adjust temperature. If the nipple picks up that baby has some sort of bacteria, it will make the antibodies for that. Women were selling their breast milk during COVID because it makes COVID antibodies. It makes antibodies for whatever they need. Babies who are breastfed are significantly less likely to end up in A&E with the first year of life. But unfortunately, there is such poor support for women. Now, the way we live is so unnatural. We're meant to live in a tribe. Women are meant to be helped by other women and elders. But we are expected to work up until our due date, give birth, have no support around with a screaming baby, never have done this before, and then get on with it. Rubbish. We're meant to have a tribe around us helping. We're meant to live in communities, not meant to be isolated, and we're meant to rest. When you have a baby, you get in bed, you get the baby in bed, get naked, get the baby naked, skin to skin contact, breastfeed, and sit the month and just get to know your baby. But that doesn't happen because we live in a very sick society. A very sick society.
Can you talk also a bit about the impact on the mother from a C-section? What does it do? I mean, there's a bit, I think, also about the cutting the umbilical cord and the timing of that, which I know you've mentioned before. So maybe talk a bit about that. But what is that? There's clearly a physical and a metaphysical impact on a woman if she has a cesarean. Can you talk a bit about the impact of that?
Well, firstly, the physical impact is it's major surgery. Some women struggle to even pick their baby up because they're in so much pain. Recovery is longer. And on the emotional side of things, so many women who have an emergency C-section or they feel coerced into a C-section, they feel like they have failed their child. I've had so many women who said, I didn't actually give birth. It was taken out of me. It can cause severe postnatal depression. And if women don't feel that they have made informed choices, look, whether your birth is vaginal or a cesarean section, as long as you have made informed choices all the way through, you know what you're saying yes and no to, and you feel empowered, that's the difference between trauma and no trauma. But when women feel like birth has just happened to them, that's trauma. And I know women who have had the most beautifully empowered C-sections. They have chosen it. It's on their watch. They have had a maternal-led C-section and a natural, as natural as it can be. So there are options, You can ask them to pull down the curtain so you can put your hands down and bring out your own baby. You can also do something called vaginal seeding, which is before the C-section happens, you can roll up a gauze like a tampon, insert it into the vagina. When the baby is born, you can rub the gauze around the baby's mouth to help with the microbiome seeding. There are more choices, but as long as women feel that they're in control and they are empowered, there won't be trauma. It's when it just happens to you and you don't feel you can advocate for yourself. And very few women don't feel they can advocate for themselves. So many women run off a people-pleasing wound, a fear of authority wound. We've had it drilled into us from school and many of us from our homes. So we don't argue, we don't ask questions. And when we hear things like, do you want to harm your baby? And coercive, gross language like that, pulling the dead baby card, you're going to acquiesce to this stuff, right? But if you are informed and you feel empowered and you have deep connection to your intuition, and it is not steeped in fear and shrouded by all the noise, you can make peaceful choices, not coercive.
Yeah. So how do you move this conversation on with women who are thinking of becoming, if they come to you before, I mean, that's obviously the best solution, but if they come to you when they're pregnant, when they've already had medical advice, how can you debunk, as we've used in the title, how can you debunk, and it's a crude title and not doesn't do it justice, but how can you debunk what they've heard? How do you do that? How do you persuade them? Because surely the reaction is what 99% of doctors say, cesarean sections are safer, and if something goes wrong, you're in the right place in hospital. Why would you take the risk of having it at home? I mean, all those things which add to fear. How do you deal with that? How do you get them to listen?
I don't do anything. I don't try and force them. If they're interested, I have to meet women where they're at. And most women are too afraid. By the time they're pregnant, that's it. They feel backed into a corner and they just do what they're told. But if they are curious and they're asking me questions, what I don't want to be is the polar opposite. I'm not here to go, no, have a home birth with shamanic drums and blah. No, like birth where you feel safe. And if that's at home, great. If that's at hospital, great. But here is the recipe for an empowered birth. And I don't tell them the opposite. No, you should give birth at home and you should do it like this, because that makes me just as bad as the opposition. But what I do, I always say to women first, you're not on trial. It is not up to you to prove your body won't fail you. It is up to them to prove it will. So let's use the Socratic approach, shall we? So let's say, for example, a woman comes to me and says, I've just got your number from so-and-so. I'm really worried because they're telling me I need to be induced because I've got a big baby, but everything is telling me not to, but they're using all the scare tactics. So I say, all right, well, I don't need to prove not, that's not my place. But they're trying to prove to you that it's dangerous to carry on your pregnancy. So let's find out, shall we? Ask them very specific questions. Let's say it's big baby. Please define big. What is big? What percentage, what margin of error do your scans carry? What percentage? And a lot of hospitals or care providers will be concerned about something called a shoulder dystocia, which is where a baby's shoulder, one or two, gets stuck in the birth canal with a big baby. So then you might want to ask them, if you're concerned about a shoulder dystocia, what percentage of babies experience a shoulder dystocia after an induction versus spontaneous labor? And what percentage of induced babies end up in the neonatal intensive care unit? Ask them questions. I'm not here to prove anything. They're the ones trying to convince you. Ask them difficult questions. Ask them data. Why me? Why do you think my baby's big? Because we've heard of babies that the poor parents were told, oh, it'll be a 10-pounder, and they're born 8 pounds. And why can't a woman push out an 11-pounder? Why? I've seen a baby born at home, 11.5 pounds, no tearing, nothing. Straightforward birth from a woman listening to her body. Ask them. They want to turn a breech baby with something called external cephalic version, where they physically put their hands on the uterus and move the baby round. Ask them what percentage of PCVs are successful, and if they are successful, what percentage result in a vaginal birth. You won't like the answer.
What is the answer to that?
It's pretty low. It's different from hospital to hospital, but it's probably about 20%.
And so what is the natural way of doing that?
Well, one, you don't need to turn. A baby can come out bum first if they feel like it. And also, we don't know why the babies breach. I mean, from an emotional root cause perspective, breach babies I see, mum is highly stressed and babies want to be close to mum's heart. We don't know. There might be a reason the baby's breach. Maybe the cord is too short. Maybe they can't turn. Maybe they want to come out that way. But there are natural methods. You can use moxibustion. You can use, you can go for acupuncture. There's lots of little neat ways. Some great homeopathy you can use to turn a breech baby. But ultimately, you can have a vaginal breech birth if you want, but you have to do your research and you need to understand the difference between a cephalic and a breech birth. Like how it works, how maybe it's a foot first, which is a footling breech, or a frank breech, bum first, legs up. Talk to people who know about breech birth. Learn. There's a great website called Breech Without Borders. Go on there, look it up, learn and learn and learn. Arm yourself to the teeth with knowledge about birth, and ideally before you're even pregnant.
And apart from your website and your service, where else can people learn that from?
What about breech birth?
About anything, about natural birth as opposed to hospital births. About
there are some great influencers. I recommend Kemi Birth Joy Johnson on Instagram. When it comes to human rights in birth, there's AIMS, which stands for Association for Improvement in Maternity Services. There's birth rights. But come to when push comes to shove, you've got everything you need. From a £30 course, which is like 30 days to understand your birth, to do full training to understand as much as a doula would do for your own birth. Arm yourself with knowledge. Every single woman needs a book called Am I Allowed by Beverly Beach. Buy that book, Am I Allowed? It's superb because it just debunks all it's the question I get asked all the time. Am I allowed? Am I? Yes, it should just be one page. Yes, you should. You can do what you want. But unfortunately, women don't do what they want because they are so fearful of the consequences. But
well,
I think
presumably men aren't much help in that equation either, because they feel mostly they have absolutely no agency at all, rightly or wrongly, and that's become a lot more acute, obviously, in the last few decades, where the notion that a man should interfere with how a woman should have a child is, has become rather more difficult even than it was. Albeit that people will go to a male doctor and he may well have a view that could be similar to the husband's view or partner's view or whatever.
For the guys, I recommend reading anything by Michel Audin. He died very recently, actually. He was a wonderful man. And he wrote some phenomenal books about childbirth. Michel Audin, E-N-T. Yeah. He's just phenomenal. He said, we don't bring down the cesarean section rate, humans will evolve, they will lose the ability to give birth. And but the thing is, if your children are born in fear into a sea of adrenaline and cortisol instead of oxytocin, that's the baseline for their nervous system. And then they're going to need a drug to fix that, a drug to fix the mum's depression, a drug to fix the psychosis, a drug to fix the milk issues. Then they're going to be all formula fed. Then they're going to need some more drugs to fix their microbiome and their gut health. It all starts at birth. It's a travesty.
So moving on, perhaps, I don't know if there's any more on the pregnancy side and the giving birth side you want to focus on before we perhaps move on to the infancy side, the impact on the child and how the child develops, and what needs to be done there to perhaps to do with some of the unnaturalness of C-sections or the unnaturalness of inductions that perhaps have left traumas.
Yeah. So let me just explain, and it doesn't take very long. Let me explain how birth works.
Yeah.
And if you understand that, you might get more curious and want to ask some more questions around birth. And look, it is complicated sometimes, and we are very grateful to have experts to help us if there are emergencies, but it very seldom should be. So let's start with the pregnancy hormone, which is first and foremost oxytocin. Oxytocin is a love hormone. It helps you bond with your baby, and it helps you get into this euphoric state during birth. Big myth here, birth does not have to be screaming, shouting, and a mess. Most births I see, there's none of that. It's just very calm, empowering. And when there is noise, mum's roaring baby out like a lioness. It's not a torturous scream because she's releasing oxytocin. So oxytocin is a shy hormone. It will only perform when the woman feels safe. So imagine a few thousand years ago, ancestors were wandering the tundra, and the woman was about to go into labor, and the oxytocin is starting, and the contractions are starting to get a little stronger. So her instinct tells her, find somewhere dark and safe. But she sees a predator. And a predator.
Yeah.
A predator. So her body does what it's designed to do. It goes, oh, that's going to eat you. Don't give birth. Stop oxytocin. Release adrenaline. And ready to fight, fly, or flee, all that stuff. So the body does exactly what it's meant to do. Now, we may not have the same external stimuli, but we do have adrenaline stimuli still. We have, okay, so what's the modern day equivalent? Bright lights, feelings of being observed, women putting their hands inside of other women for no reason, hearing other women give birth, BP machines. How is this conducive to physiological process? Because all this external stimuli is going to go, oh no, this ain't safe. Stop releasing oxytocin. And then the poor woman who is trying to give birth in an environment such as this, the midwives come along and they write their notes on the board, failure to progress. No shit. Of course, because the body is doing beautifully. And these poor women, they go in and they lie on the back because they're told to. Well, that doesn't bring the baby down. If you lay on your back to give birth, you decrease your pelvic outlet by 30%. You're trying to push uphill, and the poor woman often ends up with an episiotomy where they cut her perineum and then forceps to drag the baby out, when just sitting upright could do the world of good. And these poor, poor souls are told, your body's failed you. We're going to give you drugs now because you're not doing it. So they put an IV up of syntocinon, which is a synthetic form of oxytocin. And of course, the syntocinon will hyperstimulate the uterus. So they get these very, very strong, very painful contractions very close together. Naturally, it's far more comfortable. So they asked for an epidural. Not many women ask what's in an epidural, because why would you? Because you want the pain to stop there and then. But an epidural, for those watching, it's 50% bupivacaine, 50% fentanyl. So that goes in the spine. And then you're rendered on your back and you can't listen to your body and get in a position that your body is telling you to, in an upright position, to bring the baby down. Now, you're not feeling the extra pain anymore because you've got the epidural, but the epidural tends to slow labor down because you're not in an upright position, so then they up the syntocinon, and so it goes. Now, because your uterus is being stimulated over and over and over again, oxygen flow to the placenta is now compromised because of the hyperstimulation of the uterus. So baby goes into distress, and they call an emergency cesarean section or a forceps or a ventouse delivery because it's an emergency. And this poor mother thanks them. Thank you, saved my baby's life. Like Stockholm syndrome. Now, there are times when, of course, things are necessary. C-sections are necessary. Placental abruption, big one. The placenta separates from the uterine wall before the baby comes out. That baby's got to come out in minutes. Or a cord prolapse, that baby's got to come out in minutes. But we're not stopping to see the hand in which the system are playing to cause these problems. And we need to educate ourselves. If you want a good birth, you need to look in your environment. That doesn't necessarily mean you must give birth at home, because if you don't feel safe at home, you're going to release adrenaline. And adrenaline is going to counteract oxytocin. If you feel safe at hospital, arm yourself to the teeth with knowledge on how to navigate the system. Make sure you've got dim lighting. You can say no to vaginal exams, especially women who have suffered abuse. Now you might think, well, they need to do a vaginal exam. Why? Why? Because all it does is tell them where your cervix is at that point in time. Because your cervix can dilate from 4 centimeters to fully in 10 minutes, or it can take 12 hours. So all that is doing is adding a potential infection into the vagina, making someone feel uncomfortable. And in fact, the cervix starts to close back up. If you're releasing that much adrenaline, it'll be like, no, don't give birth. Tuck that baby back in. You can say no, and you can do it on your terms. Get a birth support worker, whether it's a doula, a birth keeper, an advocate, get one. If you spend how much a month on Netflix, coffee, Amazon, put your money into getting someone that's going to help you advocate for yourself, because it's not going to happen on the system.
What would you say if some people are going to be hearing about this notion of somebody encouraging a home birth, really possibly for the first time, and they may well have had fear stories about how many of them go wrong and how dangerous it is. Do you have any statistics that might reassure somebody as to how safe or how many home births have gone wrong, and what the circumstances that might be, how exceptional they might be, that might reassure?
Statistically, home birth is safer. Statistically, if you're a low risk pregnancy, you've got no issues like gestational diabetes, cholestasis, or anything like that. I'm not going to quote stats because I can't remember them specifically and I don't want to get them wrong, but they are in the book, Am I Allowed? Statistically, home birth is safer.
And when you say when you say that, unless you're in a sort of high risk, you mentioned a couple of things there. Would your definition of high risk birth be different from the doctor's, the hospital doctor's view of what high risk birth might be?
Yeah, I don't have an opinion. It's the mum's opinion. So there would be births that I would probably say no to if I thought, do you know what? It's nothing to do with what I'm thinking. It's what I'm feeling. If I'm feeling that something isn't right, and I meet a woman, I'm like, Like if she wants to hand over her birth to me, I'll say no. It's not my responsibility. I'm not here to do anything medical. I'm here to support you in your feminine power. But I think it should be down to the woman. I mean, even if someone's got gestational diabetes, it doesn't mean to say they can't have a home birth, and that can be managed with diet if you sort it out quick enough. So if that woman understands nutrition and the correlation between protein and blood volume expansion, this is never taught in the system. Midwives aren't taught it, so therefore women don't ever get to hear about it. But I wouldn't define them. I wouldn't put them in a pigeonhole. If they came to me and said, I'd like to have a home birth and this is my risk. I mean, look, for God's sake, you're classified as high risk if you're over 35 because you're called a geriatric mother. Jesus. Geriatric mother at 35 years old.
Where does that definition come from?
They say over 35, you're at higher risk for problems based on a study in the 60s. But let's say a 21-year-old woman walks through the maternity system. She eats McDonald's 3 times a week. She smokes. She doesn't look after herself in the slightest. She's got poor mental health, but she doesn't tell them. She's low risk. You've got a 42-year-old woman who's pregnant, who is a yoga instructor, who practices meditation every day, who eats impeccably. She's high risk because she's 42. It's insane. This is not woman-centered, individualized care. And if you accept being tarred with the same brush, fine. But if you think, well, no, this has got nothing to do with me, this is just data. Ask questions. Birth where you feel you want to birth, but take responsibility for your birth. If you don't want to take responsibility for your birth, that is something I really understand. Sometimes it can be too overwhelming, but there is certainly a system that will take over for you, and we already have it. But if you really want to be empowered, learn, understand your body, get support. It's what we're here for.
So let's move on to post-birth and infants and the impact. And I don't know how much studies you're studying or how much you've been able to observe over the time of your 14 years of doing this, and whether there's things you can identify, trends or typical types of problems, or you've mentioned some of them, that a baby that's been heavily induced or end up having an emergency cesarean, or just not a natural birth as you would describe it. Is there enough data to make a comparison with how those infants grow and how they develop and what the trends are and what the impact is of a, let's call it, a less natural birth?
Yeah, there is. To sum it up, I urge every single person watching this to go and watch something called Microbirth. It's on Amazon by Tony Harmon, Microbirth. And that teaches us about how C-section rates are destroying our gut health and the impact it has on children. Now, don't sit here and shame yourself if you've had a C-section. That's not helping anyone. It's certainly not going to help you. And I'm certainly not shaming, because this is just a byproduct of either a genuine emergency or you didn't have the support. And there are things you can do afterwards to help a baby's gut health by what you're eating, what's coming out of your breast milk. Later on, you're weaning the baby, what the baby's eating. There are so many things you can do to help a baby's microbiome afterwards. But yes, I see with young babies, allergies, lots and lots of allergies. I saw it when my daughter was at school. She's now homeschooled. The amount of children in class that have got so many issues. And when I spoke to their mums, I'm like, was baby a C-section? They're like, how do you know that? It fits. Now, you could argue, well, it's not exactly difficult. like most women have a C-section now, like 1 in 2. But it fits the allergies, the eczema. But deeper still is the emotional root cause. So skin problems. You got to think how this is. It's where it's the chicken or the egg scenario. It's the mother's emotional health in pregnancy, the mother's emotional health during the birth. Like I said, if a baby is born into a sea of oxytocin, that's the beautiful baseline for their nervous system. But if they're born into adrenaline and cortisol, that's also another story. Think of the skin like this. Your skin is your physical first defense. When the skin erupts to seemingly harmless things, what's going on emotionally? What are you defensive against? Now you could say, well, baby's not defensive against anything. No, they're not. But their mum is. And that is generational trauma. When I see loads and loads of skin conditions with children, their mums are often, what's the word? It's defensive. It's like they brace. They're constantly bracing for the next problem and the next problem and the next problem. And they helicopter. Is this person's acting this way and that person's acting that way, I'll be okay. It's outsourcing of peace constantly because their nervous system is fried because they weren't modeled it when they were younger. So they've got someone who had an unhealed nervous system parenting them. They never stopped, assessed, and understood this is actually an emotional thing. And it just keeps going into generation after generation until someone stops and goes, no, I'm cutting this. I'm not doing this anymore. Heal the mum, heal the baby. Mm-hmm. So then you've got intestinal issues. Obviously, that's microbiome. That's one level, but there's emotional root cause as well. So adults who have got, let's say women who have got, I don't know, endometriosis or polycystic ovaries, that's not feeling safe with a woman figure because that's right down in your energy lines, your root chakra. And your root chakra is where you feel grounded and safe and literally rooted. And every single time, without fail, if I've seen someone in my office with polycystic ovaries, they have a very difficult relationship with their mother. They don't feel safe. Don't feel when they were a child it was safe to make a mistake. They don't feel they've got this center. Problems further up the digestive tract. So where your solar plexus is, that's intuition being blocked. So if you are told from a child, don't trust yourself, or no, that's wrong, stop speaking up. Eventually you will learn, I can't trust my intuition. Up here, further still. And it's very different between men and women, because when it comes to trauma and love, men tend to push love away and women internalize their own self-hate. And when we see that, we see breast cancer. And with men, when they won't accept love, they've got I'm not good enough wound and I don't deserve it. We see heart problems, unresolved grief. We'll see chest problems, respiratory problems. But it's so hard to pick where it started because it's often generational. And we see this cycle going on and on until someone stops to start doing the inner work. It's so nuanced and it needs a lot of attention, a lot of someone listening to what's happening, where to start, what the root problem is. Heart murmurs, that's unresolved generational grief. It's really interesting. The more you dig deeper, the more you go, oh my God.
Is heart murmurs developing in infancy or are you talking about later in life?
In infancy.
Infancy.
Yeah, definitely. Generational grief, unprocessed generational grief. But it goes in layers, you know, like, okay, let's say with the vaccine, you have two people who've had the same batch, the same vaccine, one develops an adverse reaction, the other one doesn't. Why? The emotional terrain has to be correct. So if you've got someone who may not have had any underlying heart conditions but end up with pericarditis or myocarditis, bet your bottom dollar there's some unresolved grief there. And why it happens more in males.
And sorry, it happens more in males because
Men are, okay, let's say there's a love wound. Okay, so let's say, for example, a little boy grows up not feeling worthy of love, rejected constantly. Dad talks down to him. You're no good. You're never going to get that. Look, Daddy, I drew this. Well, you didn't color inside the lines, did you? The child learns, well, I'm not enough. And then when love is trying to be presented to this man when he's older, he'll reject it. He'll push it away, and he'll always do that in relationships. You'll see it all the time. Men who get really comfortable in a relationship and then go, nope, this isn't happening. And they'll sabotage and sabotage. This is just one example. I'm not saying this is the emotional terrain for everyone who has a heart condition. That's not what I'm saying at all. But it's just one example. So a little boy will grow up thinking, well, I'm not enough. I'm going to be rejected anyway. So I'm going to push love away. My siblings always bullied me. My mum always spoke down to me. She never saved me. She never thought I was worth helping. So in relationships as an adult, men are more likely to push love away. Heart problems. Now let's take the little girl. And this is just inherently different between the masculine and the feminine. Women who were little girls who didn't feel they were enough. Like, Daddy, Daddy, look, come and see what I've done. Not now, I'm busy. Or totally scolded by mother all the time. So they end up becoming a people pleaser and they have to helicopter everyone in their life. Well, if this person's happy and this person's happy and they're doing this and I've got this person doing that I want over there, then I can be okay. They never spend any time with their own feelings and thoughts because the very thought of that makes them feel sick because they don't like the silence holds. So they perpetuate this people-pleasing cycle, this martyrdom cycle. I will do everything. But what they're not looking at, because you can't heal what you can't feel, they're not feeling the self-hatred. Because here's the thing, right? When you scream and shout at children and you talk down to them and you don't listen to them, they don't hate you, they hate themselves. And that self-hate stays there and it lives in the body until one day your body screams. Here you go, here's an autoimmune condition. Here you go, have ME. Or whatever it is. Because we soothe, we perpetually soothe. When we were ill as a child, I'll go to the doctors, take a pill for this. I feel difficult feelings. Oh, stop it, you're fine. Get on with it. Or whatever. I mean, if you don't have any emotional attunement as a child, you don't feel it's safe to make a mistake. You don't feel it's safe to ask for help. So you bury and you soothe and you soothe. And then guess what? You start having proven to you when everyone you meet, from your school friends to when you grow up and go to uni, to your partners, to your colleagues, that mirror will be shown to you everywhere. But we don't actually look. We blame the mirror and we don't look at what it's showing us to heal because we keep soothing. We will scroll and scroll and scroll through Instagram. We pick up our wine, our cigarettes, our coffee, or get on the phone and whinge and say, yeah, see, they are behaving like this and it's their fault and it's their fault and it's their fault, because we can't sit in our own agony. Like I said, you can't heal what you can't feel, and we're getting healing very confused with soothing. But to heal, to truly heal.
When you say we can't sit in our own agony, do you mean that we are struggling to take responsibility or struggling to see what the cause is? Is that what it is?
Take responsibility, yeah. We outsource all the time. When this person's behaving how I want, I'll be fine. But you're not. At no point does your little monkey mind ego start saying, oh, you can be happy now. It doesn't. It will find something else and something else and something else. Because we don't sit in our own agony. We don't sit with our not enoughness and rejection wounds. Like, look, I'll give you a really basic example. You've got a couple in their 30s, they're dating, right? One of them sends a text and there's no reply. And I'm sure many of you watching can relate to this. They're not replying, they're not replying. That heart going 10 to the dozen has nothing to do with the scenario you're in now. It's gone way back to when you first felt that, when you were probably younger than 7 years old. Because before you're 7 years old, you're in theta brainwaves, which is basically hypnosis. So if I were to put you onto hypnosis now, you'd be in theta. You believe exactly what you're told. And many children are told naughty, good, bad, whatever. Oh, that's who I am. And if they've got an abandonment wound that they're carrying around, yes, they are going to get this heart palpitation when someone is not replying to them, because deep down, they don't even realize it. They're afraid of being rejected or abandoned. And if you don't tend to that emotional wound, it will show up as something physical. It's very nuanced. I'm making it sound simplistic here. That's not my intention. I'm just trying to give you an overview. Or if someone has a not enough wound and they go for a job interview and they don't get it, well, someone who has got an emotionally healthy terrain in their body and they're in awareness and they're healing, they go, okay, well, that's not for me. Someone who's got a rejection wound, when I'm not enough wound, that will send them spiraling. Or a stranger who gives them a funny look. It's reactive, not responsive. And I urge anyone planning a family, do the work before you have more children or have any children. Do the work. I wish I had before I had my first.
I'm sure everybody thinks that. I mean, it is an irony that it's probably one of the things that we do in human life that is the least research thing we do. You know, people do a lot of research before they buy a house. They do a lot of research before they buy a car. I don't think humans do research at all before they go and have a child. So there's a lot to be said for those comments, but it's not something. Partly, possibly also because many couples would be worried about whether they can have a child, and then they think they're putting the cart before the horse by doing a lot of research to prepare for something that might never happen, and they have to live with that disappointment.
But that's the wound. That's the wound. That's the wound you have to heal. So, oh, I can't get pregnant. Yes, of course, that is an isolated event. But to not be able to get past that is old. So you can sit with uncomfortable feelings and move through them, or you're not healed and you're carrying around an old wound. You heal that and you won't have an attachment to an outcome.
So what's your process? Sorry, when you finish that, just perhaps talk a bit what your process is for that. And I know we're going beyond infancy in some ways, and we're talking now about dealing with couples and treating couples and how best we might treat those. But they're going to be listening to this who are going to have the same thought that they've had that experience, they need help. Your focus is, as I see it more from your website, what you said is more about the actual childbirth, pre-childbirth and childbirth and immediate post-childbirth. Are you working with other people or working yourself also dealing with adults to get through some of these traumas?
Yeah, so I'm very fortunate actually. My Substack recently got to number 12 on health and wellness, on trending in the world. My Substack. So yeah, my Substack blog, it got to number 12 in health and wellness, right. Because I teach people about the inner work. So the other side of my work is this. It's called alchemy, inner alchemy, how to heal so we don't bleed over those who didn't cut us, and how we can start healing our old wounds. There's tons of free content on my Substack. And I also have courses on When Push Comes to Shove website. It's called the Unity Project. It's little mini courses, and you can big healing facilitating courses, but have a look in your own time. I think this is probably the most important thing to do before you even think about having a baby, is to do the inner work. And here's the process. It's the top and bottom of it anyway. When you're triggered, right, no, I need to go back and explain this, otherwise it's going to sound really out of left field. When a child is born, they are authentic. They're as authentic as they'll ever be. They haven't learnt yet that they get conditional love, or that they haven't learnt who they are. Like if I asked you now, who would you be if you weren't taught who you were? You'd be as you were as a baby, before the ego started to run the show. So a child has a choice. They can either remain authentic or they can form an attachment. And a child will choose an attachment every time without fail. And the reason they will choose an attachment is because any infant mammal, if they don't have a primary caregiver, they die. And they instinctively know that. Now, it might be really subtle. I'm not saying everyone, you've had awful abusive parents. I'm not saying that. Of course, there are people who have experienced that. But what I'm talking about is not overt. It's subtle. So, little 3-year-old girl out with her mum. And her mum has not done the work, is not healed.'s not even aware that she's reacting from her own. She just thinks that's how you parent. And she sees an uncle. She says to her little girl, go and hug him. Now, if she were aware, she would say, listen, you're going to have to hug your uncle because my well-being depends on what he thinks about me, because I outsource all my emotions and I need to triangulate with this man. If you don't hug him, I think he's going to think I'm a bad mum, so you've got to do what I say. Okay. Now the child will go, oh, I don't want to hug him. And the mum's, come on, hug him. Come on, don't show me up. So she acquiesces to it. Wound. Well, I'm not worth protecting. She's not listening to me. She's not emotionally tuned to my needs. Another wound, another wound, another wound, another wound. And that is how you'll see your life, through that lens of that rejection, or that not enough, for I'm not worth protecting wound. So when you get older, it will show up everywhere. Let's say it's not enough. That's a really, really easy one. You might see it at school. You might come home, Mum, the teacher's singling me out. I'm sure they're picking on me. Oh, it's just your imagination. Get over it. Not enough. And then you might carry on into your teenage years. You have a friend that picks on you. Mum, they're being really nasty. Dad, they're being really nasty. Oh, I'm sure they don't mean it. Get on with it. Just, oh, you should stand up for yourself. Not enough. I have no emotional attunement. No one is listening to me. They're just telling me how to fix it rather than listening to what I need and being a soft landing. Then that will be proven over and over again in your adult relationships. You will meet someone in your adult life who makes you feel exactly as your mum did when you were 4 years old. And then you got two unhealed people blaming the mirror. You made me feel like this. No, they didn't. It's already in them. It's just a wound, and they think it's an isolated event. You've done this and you've cheated, so it's made me feel. No, it hasn't made you feel. It's already in you. A mirror cannot reveal what isn't there. So here's the process. You get triggered. 1, you have to allow yourself to feel what you're feeling. Well, I'm angry right now. We have every right to feel angry. So just validate, I am allowed to feel angry. 2, what is it I'm feeling? It might be anger. We just said allowed to feel that way. What is it I'm feeling? Is it anger? Is it fear? Is it dread? Is it anxiety? So name it. Where in your body is it? And this is very telling. Is it here? I'll tell you what, I have treated 7 women this year with thyroid problems without thyroxine because they've got a very, very blocked throat chakra because they do not communicate their needs and they don't show their boundaries. They accept scraps from other humans because they're not enough, and they hold it all here. So where is it in your body? Is it in my throat? Have I got a ball in my throat? Have I got a knot in my tummy? Is it in my chest? Is my heart racing? And the next step sounds really simplistic, but this is the difference between healing and soothing. Feel it. Feel it. Don't soothe. Now, caveat. Do this if you feel safe, because you wouldn't bend over on the M25 and type shoelaces, would you? It's dangerous. If you are safe to do so, scan the room. Just make sure you're not going to be attacked or you're in a physically safe environment. If you've got history of psychosis or anything else, you must see a mental health practitioner. But feel it. Otherwise, feel it. What we tend to do when we're triggered, and it could be by something on the news, it could be by your partner, what your mama said. Oh, you think I'm not a good parent then? Where are you feeling that? Is it here? Don't blame the mirror. She may be acting like a moron, or he may be acting unreasonably. It's not about them. Forget them for a second. Don't outsource your piece. Where in your body are you feeling it? And feel everything in it. And it will feel horrible. But you can't heal what you can't feel.
Yeah.
Something amazing happens. It will dissolve.
Right. And people obviously need guidance to go through that, because that's quite a bit of trauma. Right? I mean, we've been coming up to an hour and a half, which is you must be exhausted. and I mean, there's probably lots more to talk about, but I wanted just to give you an opportunity at the end to pick up anything that you think we haven't felt. But I wanted, while you're thinking about that, I'm going to make you multitask and talk a bit about opposition you may have met or have in doing what you're doing, how that's manifested itself, whether it's on the increase, on the decrease, just a bit about that experience.
Oh, I had so much opposition. In fact, when I started this movement, I was working with another birthing company, and it showed me a really good mirror that I had to heal. And I was blaming the mirror for ages. So I was working with this company. So in my former life, I was a singer-songwriter. I used to write for Sony, and I wrote a song called Breathe Again, and it was to spread awareness.
It's a lovely song, beautiful, very lovely.
And it was to spread awareness of when push comes to shove. And they weren't happy with me saying women. They wanted me to say birthing people. And I went, no, only women give birth. What do you mean? And then they were telling me what I could not say on interviews, and it all got a bit much. And they were funding this PR company for me. And I said, no, I'm not doing this anymore. Take your money. I don't want it. And then they started tweeting that I was stealing money from this campaign to get my song out there. But what they hadn't realized was I had another financier. They were still running their company, and they thought they were running mine because they kept seeing all this stuff out in the media. So they put 2 and 2 together and made 12. And they started tweeting, oh, Nickita's doing this, that, and the other. And I thought, oh my God. And I wanted the world just to swallow me whole. And I realized this is not new. This is old. I have felt this feeling so many times. This is a gaslighting wound. And I had to sit with that, and I had to heal that. Otherwise, I'd keep seeing it. And I'd seen it so many times throughout my life. It kept appearing, whether it was from my mother or a partner or a friend or this lot. Of course, it was still there. And yeah, I've met lots of opposition. I've been called a hippie, a tinfoil hat wearer.
Those are all compliments. And that's great.
Yeah.
It's a badge of honor.
I've had a few trolls. Saying I'm a gatekeeper, cult leader. I've been a cult leader. And also I had some guy make a very strange video about me, saying I'm a cult leader, I'm a gatekeeper, keep families apart. But what he left out was he was abusive, and the poor woman left. yeah, I've had some very strange things. I've been told I'm controlled opposition. Oh, you name it, I've had it. It's none of my business.
Yeah.
Just, it's not. And if it triggers me, I've got to heal something, haven't I?
But in terms of your practice, have you had any interference in that?
Kind of. I've had the police called on me. I was at a birth, and it was a friend of mine I've known since I was 2 years old. They called the midwives, and the midwives wouldn't come because I said, call them, I can see meconium, which is a baby's first poo, and it was quite thick. I said, you better call the midwives meconium. And they wanted the midwives to come, and oh no, we're not coming up from meconium, we'll send an ambulance. Anyway, baby came out very, very quickly. Baby was fine. And when the paramedics got in, I was just holding the placenta. Mum was doing something. And then the next day, the poor family, the police at the door saying, oh, we're here because of a free birth, someone acting as a midwife. And luckily, the dad went, I'm going to stop you right there, pal. No, off you go. So I don't do anything medical. I'm not there to do anything clinical or anything like that. I mean, there's talk at the moment of Doula UK trying to build a test case to stop doulas and make sure they need a governing body, because just like a midwife would need the NMC, they want some doulas want a governing body for doulas or birth keepers. We'll go ahead and do it. People will always find a way to connect with other human beings. And love will conquer all, not fear.
Yeah, yeah. So, is there anything we've talked about a lot, and you've given us a lot of your time. Is there anything you think that you still want to add before I sort of finish with a few closing questions and see if anybody who's listening wants to ask some questions directly?
No, I think I've been speaking enough. I'm sick of the sound of my own voice, let alone everyone else listening.
No, I think that was the point that we wanted to hear you. But so let me then ask you. So you're doing a PhD. You're clearly you're moving from what started, it seems to me, from something that started as something to do with purely with birth to something that's moving much more holistically into infancy and adulthood. Where do you see yourself going? Where does this end up? And I mean, and it is the aim for you to engage in this in a increasingly in a preventative way, I guess.
Yeah, well, that's what I'm doing now. I run retreats. I do one-to-one clinics to help people through, sift through their core wounds. I go and speak at festivals. I mean, even a few months ago, I was in a room full of CEOs saying, you can't lead from burnout. You've got to lead from wholeness and remember who you are and be authentic. I've just written 2 books, actually. So look out for them. I'll let you know when they're out, Bernie. So one is called The Mirror in the Matrix. And that is about healing and understanding the illusion, the illusionary nature of which we live. And the other one is called Birthing Anyway. I think I've got a copy here. Oh, no, I haven't. Birthing Anyway. It's written in the style of, preppers, like they prep for dystopian futures. It's written in that style, as if to say, if you're birthing and no one's coming to help you, this is what you need to know. And I think when people read it, they'll see, well, do we need to wait for a dystopian future to do this? Or could we just understand our bodies now? So that's called Birthing Anyway, and The Mirror in the Matrix. But I will release all of that info when it's coming out on my Substack. which is just simply look up Nickita Stark on Substack and you'll find me. You can subscribe for free. And I have a lovely paid membership on Substack. It's just £11.11 a month. And it's called Awaken Self Healers. And you get to be in a private WhatsApp group, everyone healing in real time, sharing what they've gone through. Every month I do a live. I'll have a guest expert on. I had a psychoanalyst last month, just giving her perspective on mental health. And it's a beautiful community. And everyone is so like curious, and they don't blame. They're like, oh, what's this in me? They take responsibility. We're not doing that. Well, if it's not them, it's your fault. We don't do that. It's understanding the byproduct of not being healed and saying, well, I do feel hurt by this person and I'm allowed to. What can I do to feel empowered by this, and what lesson can I learn? It's absolutely beautiful watching people flourish in this gorgeous community. So yeah, I think that's about me done, Bernie. Thank you so much for having me on tonight.
Well, it's a great pleasure. It's lovely to hear you, and thank you very much for your time. And if there are any questions from people listening indirectly, wave, and we'll let you on to ask before we close.
Absolutely.
Let me ask Louise to join the stage and ask a question.
Hiya, Louise, thank you. Hiya, Arno. It's just been amazing. Thanks so much. It's just been so interesting, and I've wrote loads of notes.
Oh, amazing!
But, yeah, it was just I was just gonna ask. You mentioned before about good microbiome for babies, and I breastfed my daughter, but I then put her onto formula when I went back to work when she was about 14 months old. She's 2.5 now, but sometimes I think what would help food-wise for a good microbiome, if she's had like a tummy bug or something from nursery, which she has had recently, what will help reboot that microbiome?
She had a year of breast milk?
Yeah, 14 months.
Oh, she's fine, darling. She's had a year.
Yeah, okay.
Don't worry. Don't worry, you've done an amazing job. Good. She's getting tummy bugs. Good. So her system is figuring out what to do with those pathogens, how to fix them, how to keep them at bay. And she might get ill a lot, and then her immune system will go, oh, okay, this is how I do it, fine. But to support the terrain of her immune system, from an emotional perspective, be so emotionally attuned to her. And obviously you're going to do that. You're a safe space. You're a soft landing if she's having a difficult time. On a physical level, liver is fantastic. It's got everything you need.
Okay, I might have to start eating that myself then as well.
And also have a consultation with a really good homeopath to see what constitution she is, because you might just want to put a remedy a day in her bottle, shake it up, get her teacher to shake it up before she has a drink. Find a constitution with homeopathy. And do you know what, liver, I can't praise it enough. Liver's got everything, and steak.
Yeah, she loves steak.
some good meat. Yeah, and then it's just kind of easy on the carbs, because what we don't want to do is have loads of amazing fatty meat and then add carbs on the top of it, because then you're going to spike your insulin, and then we're going to see issues there. So make sure it's a very good combination. So very small amount of carbs, lots of fat and protein.
Oh, okay. Thank you so much. Thank you, Ben. Thank you
for coming.
Anybody else in the room with us who'd like to ask a question? Yes. So let me just ask you to join as well.
Hi. Hi. My name's Amy. I'm a midwife. I've just finished work.
Oh my darling! So nice to see you. How was your shift?
It was long.
Oh my God.
I'm really a big fan. Followed you for a while. My dad actually introduced me to your things. I find my job really disheartening sometimes, because I joined actually on the half of what you stand for in natural birth. And I feel very torn sometimes by women's experiences and by what you were saying. And I don't know if you have any advice for me. Because I feel like long term I can't really do it forever. It's hard.
I hear you. I hear you.
Yeah.
Okay, first of all, well done. Well done
Thanks.
for sustaining how you have so far, because I know that is a hellhole. And the and you can't speak up, and the harm that you will see on a daily basis is soul destroying. So you have one hell of a strong soul, and you should be proud every day, and you should love yourself every day and turn up and be the best midwife you can until you can't do it anymore.
Give the women advice where they can go and read, and I try and not influence too much, but I do try my best with that.
Okay, so I think where you can influence a lot is when you drop your NMC pin and you come and train with me, birth keeper. I have got a year course. It's called Artemis Birth Attendant Academy, and I founded it with my colleague Angela Chamberlain. And Angela was an award-winning midwife, and they tried to get her to have the vaccine, and she went, nope. And that year, a lot of midwives came and worked with me. I ran a course called the Midwife Lifeboat, and it was for the midwives being told no jab, no job, and all that nonsense. Angela and I got very close. We had the same vision, so we founded Artemis Academy, and it's for people just like you. And we've had loads of former midwives or midwives who want to leave, but they're trying to. I'm talking from a dog's legs, and that's really funny.
My cat.
We've got so many midwives on this course. It's 55 modules, and it's taken people on average about 18 months to complete. It is nothing you will learn in midwifery. It's ancient wisdom. Hello, cat. It's ancient wisdom. We talk about emotional cause. Right. But essentially, my love, we've had midwives do the course, leave their job behind, drop an NMC pin, and work as an authentic birth keeper where they're not answering to anyone and they are with women, not the system. You need to talk to Angela, because she will feel everything you feel. And she was in your position 3 years ago. But she is a thriving birth keeper. She's got the most busy practice with no advertising. Everyone comes to her. She's the birth keeper in the Midlands, and she has to turn clients away. If you go to artemisbirthattendantacademy.com and reach out to speak to Angela, because I mean we can talk all day, but I've been a traditional birth keeper for eons, and I think Angela will be more relatable to you. But we've got granny midwives who serve the Amish and the Mennonite community teaching on this course, and they know birth. It's not pathologized.
It's fascinating, because I've listened to you a few times where you say that we've lost things in tradition, over the time, and that we've over medicalized, and I just see it all the time at work, that we just over medicalize, we cause problems. And then we have to explain to women that they've failed, like you've said. It's just so difficult, because they feel like they failed. But like today, I had a lady who had a natural birth, and I said, "You are amazing." She was like, "Oh, I want a C-section next time," like joking. And I was like, "Think about what you've done. If we did the Great North Run, we'd celebrate for weeks. Oh, look at me doing a marathon or something." But for having birth with just gas and air, like, she is amazing. And I tried to say to her, like, that's such an achievement, and she didn't like believe it in herself. It was, but I could see it in her eyes, like she lit up when I was talking to her, because she didn't believe like how amazing she was.
Yeah, because a lot of people are set up for failure right from word go, and not from the system even. It's from what they see on TV, from the horror stories, I mean, it's like, okay, this is one thing that really gets me what we teach in Artemis, which we just don't learn in midwifery, and it's the correlation between protein and blood volume expansion. So
Yeah.
like, a lot of women will be very interested to know this. If you've heard of preeclampsia, I'm obviously not talking to you, I'm talking to other viewers. Preeclampsia is quite an issue for women at the end of pregnancy, and it's the hallmark are high blood pressure, swelling, induction, right? Straight away. Now, while you're pregnant, this is so important, and every woman should have this as a foundation of nutrition, right? When you're pregnant, your blood volume has to expand by up to 60%. Depends if it's a singleton, twin pregnancy, or whatever. In order for your blood volume to expand sufficiently, your liver has to perform 500 metabolic functions. In order to do that, you need at least 120 grams of protein a day to produce albumin from the liver and all the other amazing things it does. The other thing is we're told, oh, chill out on the salt. Women can have as much salt to the taste as they want when they're pregnant, especially, like, well, not table salt. I'm talking about Celtic salt here, pink Himalayan rock salt. Now, fast forward into the 3rd trimester, right? You haven't expanded blood volume sufficiently, so your body thinks it's hemorrhaging. So what it does, it starts to draw all the water out of your cells. What happens when you draw water out of your cells? You start to swell. And then what happens?
Bleeding.
Blood pressure up, preeclampsia.
Mm.
Just understanding the correlation between protein and blood volume expansion can prevent things like preeclampsia. Okay, placental abruption. If your blood volume isn't expanding sufficiently, how is all the blood, all the oxygenated blood, going to get to the placenta sufficiently? And other things that are never looked at, sleep apnea. If a woman stops breathing 20 times an hour, how is she going to get oxygenated blood to the placenta? And then we wonder, oh, why did she have placental abruption? There's no car accident. She didn't fall down the stairs. Nutrition. What's going on with nutrition? I mean, it's not the be-all and end-all, of course, but it's a huge component. And don't you think that women would want to know this? As a gift.
Time as midwives, we don't have enough time to give all the information, and the women sometimes don't read, and then they depend on the doctors, what they say, and that's sometimes not based on facts. It's very flawed.
Yeah. And you're in an impossible situation, my darling, because you're in a system which doesn't like questions from women or midwives. You've got obstetricians who might as well be wearing capes, right? Da, 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 da. And you're not allowed to say anything.
Yeah.
Because if you
Very true.
Yeah, and it must be agony to watch. Book a call with me and Angela, and we can have some time, just us. Book an hour with us, whatever you need, and we're here to support you. Okay? Thank you for being so brave, and thank you for serving women.
Thank you. I try my best.
God bless you. Thank you. I can't hear you, Bernie.
Thank you very much for your time. It's been lovely to listen to you, and I think and hope the audience has picked up a lot. I certainly have, and I hope that we can speak again as it develops and as your PhD comes closer and your practice gets broader and broader. So I'll end the live stream, but stay on for a bit just after, as we finish the live stream. Thank you again, Nickita.
Thank you. God bless. Thank you.
Bye bye. Right. I think that's